kind of interesting, and still trying to work out how exactly I feel about it, frankly. So, it's like Washington. I think probably some other states will do this, or have already maybe done it. Let me know down below if others have, or if this is happening where you live. So, Washington State is mandating, it says, state workers, state employees for the state of Washington to get the COVID vaccine, along with healthcare workers. And I saw somebody I follow on Facebook works in the healthcare field, and they were very pissed off about this. It's definitely the impression I got. And so it seems like there's these two ends of the spectrum on this issue. The state requiring people to get this is, kind of for the collective good. It will stop, as many people from potentially dying or getting these serious complications from it if they were to get COVID. So it's kind of a protective measure, or I would assuming that's kind of the rationale that people would say behind this. And then, people against it, they would say it's, governmental overreach. It's the government being authoritarian. They shouldn't have the choice to dictate to me what I have to put into my body and not. And honestly, I'm kind of torn either way, because it does seem like it could be a little bit of overreach requiring this for state employees and healthcare workers, but then I also see how it could be a protective factor as well. So it's kind of complicated, right? So this is the governor. We have to recognize the reality. We essentially protect our vulnerable communities, prevent future calamity to our state, and to once again be on the path to full recovery for the state. It affects any employees working for state agencies, state contractors, healthcare workers, both in the private sector, nursing homes, adult family homes. About 60,000 government workers, 40,000 healthcare providers. So it says county will mirror the same thing. So King County, city of Seattle looks like will be doing something similar as well. Can you opt out? Limited exemptions are allowed for medical or religious reasons. State employees can contact the human resource offices. Exceptions must be requested and do not include personal or philosophical objections, Inslee said Monday. Employees who are exempt may have additional safety requirements. What if you refuse or refuse to show proof? They will be fired for non-disciplinary dismissal for failing to meet the qualifications of the job. Same applies to people who do not provide proof of vaccination. Different ways you show proof. Is it legal? Inslee's office states that under a state of emergency, which was declared in February 2020, the governor may suspend statutes and prohibit any activity it believes should be prohibited to help preserve and maintain life, health, property, and public peace. Inslee's office has also added that as a large employer, the governor has an obligation to provide a safe workplace for government employees. Pretty interesting. But again, I think this is kind of the puzzling part. So the governor, Inslee, is not mandating masks, but he's mandating getting vaccinated, even though if you're vaccinated, especially with this Delta variant, it's been shown that you can still transmit the COVID-19 coronavirus if you're vaccinated. So, frankly, I think it makes a lot more sense to continue to mandate masks than it does to mandate the vaccine. And why not if you're going to do one, why not do both? And if you're going to do one, I would say mandate the mask. I don't know. That's just me, though. But I also really appreciated this article at The Nation by Rhea Boyd, pediatrician and public health advocate. I'll show you the title if we can find it. The choice to vaccinate has never been free. To increase vaccination rates, then America doesn't just need free COVID vaccines, we need free healthcare. That's, again, really shows how right-wing politics is in the United States, that, all these cities, states, municipalities seem to be mandating people to get these vaccines, but why can't we get fucking healthcare for everybody? And then this article, Rhea does a really good job of pointing out, a lot of people like to say the unvaccinated are self-selecting, selfish gaggle anti-vaxxers, but the truth is that when compared to those who have received a COVID vaccine, those who have not are more likely to be children, working age adults who earn less than $40,000 per year, Black or Hispanic folks, and the uninsured. So, wouldn't it make a lot more sense if you want to increase vaccination rates, make sure everybody has access to health care? It would probably assuage some of these people's concerns about, being uncertain about, putting this into their body if they have access to health care. Because then if they have any complications, they could go get the health care that they need for this. Jesus Christ. Look at that. These are the most vulnerable groups among us. Children, working age adults who earn less than $40,000 per year. So the working poor, Black or Hispanic folks, and the uninsured. Again, these vulnerable and marginalized groups. These groups are not some random assortment of people best categorized by an aversion to modern medicine and science. They are not our nation's. They are our nation's working poor. The people the U.S. healthcare system has historically most harmed by chronically neglecting their needs. Yet, when it comes to U.S. healthcare system, choice has always been constrained by broader forms of inequality and their profitability, because it turns out that tiering care, such that some people are rendered more vulnerable to death and disease while others are rendered marginally less so, is quite lucrative. Organized around the insurance market, the U.S. healthcare system distributes resources in a hierarchical, racially segregated fashion, with care flowing toward the highest payers, people who work in the industries that offer private insurance or have personal wealth to pay out of pocket, not those with greatest need. Hence, why all of these people, don't have care, aren't vaccinated, is part of it, obviously. Accordingly, regions with high rates of uninsurance and underinsurance, like the American South, experience higher rates of hospital closures. Care could be called, care deserts. So when 41% of those still waiting to get a vaccine say they're concerned about the cost, they just aren't penny pinching or ill-informed. Obtaining healthcare in this country is rarely cost neutral. It's definitely never cost neutral. You got to figure out how you're getting there, if you have insurance or not, if there's going to be co-pays, deductibles, premiums, if this provider's in-network, out-of-network, etc. Foregoing wages, childcare obligations, gas money, parking fees, bus fare. People incur costs simply to arrive at the return from all manner of medical care, let alone a COVID vaccination. for those who lack sufficient income to cover costs or the necessary benefits to buffer unexpected health scares or the possible side effects of a vaccination, the choice to vaccinate has never been free. To increase COVID vaccination rates, then the U.S. healthcare system will have to address these hidden costs of care. And I don't know, I've heard different numbers, like one to 200,000 people wouldn't have been killed from COVID-19 if we had universal health care in this country. Not really talking about that very much, though, are we? What is more, when 78% of those waiting to be vaccinated report concerns that the COVID-19 vaccine are not safe as they are said to be, such concerns are not markers of ignorance, they're markers of fragility. They reveal the inhumane choice before Americans between the real and perceived risks of COVID infection and those of vaccination. That choice, while freely made by those who understand that the risk of COVID infection far outweigh the risks of vaccination, is not easy to navigate for those who lack the info to predetermine which blows they can afford to weather financially and physically, and which ones they cannot. To increase vaccination rates, then, America doesn't just need free COVID vaccines. We need free primary care, hospitalized care, surgical care, intensive care in every community in the country, along with dental, vision, mental health. Because even though 90% of Americans may live within 5 miles of a COVID vaccination site, too many still lack access to regular provider who can recommend vaccination in the context of their specific medical history, familiarity with common processes to obtain care, trusted sites for medical procedures, and reliable transportation in a crisis. I mean, think about that. Everybody has healthcare in the United States. Everybody has, a doctor, a nurse, a healthcare provider that they're connected with, have a good working relationship with. How would that not increase vaccination rates? Of course it fucking would, right? In other words, to be successful, the COVID vaccination effort is going to require the kind of access to care our system has never created, access that is universally free. Agreed. Let's see. Blaming people on the basis of vaccination status may be politically expedient, but as little help us understand why so many still lack the protection so much of the world is clamoring to receive. Vilifying the unvaccinated as a monstrous monolith misses this vital fact that what the unvaccinated have most in common is how our healthcare system treats them as a group to be punished or ridiculed for living shorter, sicker lives instead of the group that deserves to have our entire healthcare infrastructure recalibrated to meet their needs. Instead of a vaccine lottery, they need and deserve universal care, information parity across educational class backgrounds, universal paid sick leave, universal child care, and deep investments to repair a social safety net that, when frayed, allows generations of black folks to fall through the gaps. Boom. And again, yeah, I think it's like if your goal is actually to get more people to get vaccinated and to convince them that, that is the right course of action, vilifying them, saying how they're so horrible and selfish is not the way to go about it if your actually real concern is getting them to change their behavior. Providing incentives like financial or otherwise, giving them education and information, which they would be able to get if we had universal health care and they were connected to their, primary care physician, for example. But yes, making it easier for people to get vaccinated, meaning that they have, their wages would be covered, they have child care if they need to drop off their, kid while they go get vaccinated, having universal health care in case they have any complications or questions after would go, a long way. So I really like the perspective that this pediatrician, Rhea, is taken by this. Let's see. Erecting a new foundation will new we should say that should say now, right? Will new require does it make sense, right? Will now require careful and deliberate investment in healthcare for everyone, not just those privileged enough to choose it. Rhea Boyd, thank you for that. Agreed. Like, it makes so much more sense to try to create a system that's going to make it easier to convince people to get vaccinated, as opposed to shaming them. And again, as they point out in this article, the vaccinated are largely the working class, people without insurance, people who are underinsured, black and brown people, black or Hispanic folks, people making less than $40,000 a year, and children. So again, I don't think we need to be demonizing or talking shit about people that are hesitant, that have been hesitant to get the vaccine. We need to be making it easier for things like getting universal health care in place, universal child care, making sure everybody has a living, good paying job, etc. That would go a long way to increasing vaccination rates, not demonizing this group of people who is largely comprised of vulnerable and oppressed groups anyway. So pretty interesting. Love to hear your thoughts down below on vaccine mandates and how to get more people vaccinated, and if the vaccine mandates are a good idea or not. Like the video if you like the damn video. Subscribe for more content. All part of the people. Peace.